Good afternoon. My name is Zhaowei. Actually, I'm a fourth-year PhD student at Brown University in biomedical engineering. So today I'm going to share some of our findings on hands-on engineering exercise positively impact student learning in nanotechnology from our recent teaching experience. Nanotechnology is an emerging research area within biomedical engineering, which focusing on material typically ranging from 1 to 100 nanometers in size. If we consider a grain of rice a small object, nanoparticles are sized 1,000 times smaller than a grain of rice. Thus, there are many advantages benefited from nano size, such as improved drug uptake. The nanoengineering and nanomedicine class offered at Brown is specifically designed to guide students in applying their engineering, chemistry, physics, and biology knowledge to critically analyze and propose solutions for current medical applications within the scope of nanotechnology. So a key concept here is this class is the integration of theoretical knowledge within practical application. We believe that hands-on learning contributes to a better understanding and effectively delivering topic to students. So the purpose here is to evaluate if there's an increased level of learning when hands-on laboratory experience are conducted in conjunction with lecture-based learning activities. Our fall 2023 cohort consists of 26 students with 8 undergrads, 14 masters, and 4 PhD students. Students were surveyed both before and after conducting the lab to assess their comfort and confidence level within the nanotechnology. Also, there's a survey after their completion of their lab report. We hypothesized that the student would have an improved comfort level and their knowledge would increase following the completion of the lab and lab report. So here, undergrad and grad students were divided into 4 groups. 2 groups focusing on fabrication of lipid-based nanoparticles, while the other 2 monitoring lipid bilayer formulation using cross-crystal microbalance with dissipation, or QCMD monitoring. QCMD monitoring measures the amount of protein absorbed on different surface. So both technologies are commonly employed in both nanotechnology research as well as clinical setting. Upon the completion of the class, we did a comparison of pre and post laboratory survey, revolve on the overall positive increase in understanding of the concept of lipid-based nanoparticles, shifting from slightly blue to more orange. Also, there's the overall increase in understanding of the QCMD across all educational level, indicating that the designed laboratory exercise enhanced the students' understanding of nanotechnology concepts. Thank you for your attention. We are looking forward for your questions. I'm sorry, there's one more question here.